My name's Darren Carr. I'm one of 2 consultant psychiatrists with the team, and I'm also clinical director for the County Directorate. As part of the medical team, we obviously offer outpatient appointments for patients, including new assessments. So the doctors particularly will offer diagnostic expertise, so people who might have complex mental health needs that need some clarity. They want to know, perhaps their GP wants to know, and we need to know what their diagnosis is, if that's important to guide their treatment. Medics will also be primarily responsible for prescribing medication for mental health problems and making sure that patients' physical health is prioritised.
Hi, I'm Charlotte. I'm the team lead for the Moorlands Community Mental Health team. So over the last 12 months, we've had a big focus on upskilling the staff within the team. So we are utilising our own resources, and with this we're building staff confidence, giving them new skills and opportunities. We've managed to retain all of our staff members for the last 12 months as well. We've had a real focus on staff wellbeing, agile working, making sure that we do team building on away days.
My name is Terry. I'm an admin apprentice. The importance of the Ashcombe Centre in the community is having a service available to them that's close by. They're not having to travel far to get to it, and I think that's a positive thing for anybody really. You know, we have busy lives and we want to be able to access our services conveniently.
Well, for the last 2.5 years, I think it is now that I've been in the Ashcombe Centre, honestly I can say that it's been life-changing. Without the support that I've gotten from the Ashcombe Centre, I don't think I'd be where I am today. To be honest, I don't think I'd be here because they took me at my lowest point, and you've just helped me build my confidence and helped me really push through the issues, the mental health issues that I've had. And I think that working with the Ashcombe Centre has really made me be in a better place mentally, and I don't know how to thank you guys, because honestly I feel very privileged and grateful that I got to work with such amazing people.
Hi, I'm James. I'm an occupational therapist, and we're here today, I believe, to share our successes over the last 12 months. In March of last year, we got together with Changes, Combined Healthcare, and we've now introduced a peer recovery coach into the team. And through this new initiative with Changes, we've been very fortunate to be involved with the development of the role of the programme as a supervisor. Being able to offer interventions from another angle as a peer recovery coach who has that lived experience with a mental health illness, which has allowed them to share their journey and give hope to the service users who maybe we've had difficulty engaging with interventions in the past, and this is providing really beneficial and enhancing the reputation of the team.
Hello, my name's Eve. I am an ARS practitioner in Moorlands Rural PCM. Just with regards to the successes over the last 12 months and relating them to the Ashcombe CMHT also, obviously we have set up this new service over the last 12 months. There has been a lot of successes as far as we're concerned, including an improvement in links between secondary care and primary care. Hopefully improvement with regards to the referral pathways between the two. There's been successes with regards to recruitment as well. Initially there was 13 mental health practitioners. There's now a further cohort of STR workers working within the community and strengthening mental health services there.
So my name's Becky, I'm an occupational therapist and I've been with the Ashcombe Centre for about 18 months now. So this is my first post as a qualified occupational therapist. The team's been really supportive and really helped me to build my confidence. They've been really encouraging and allowed me to support the anxiety and depression pathway, which has currently been adapted to have more of an occupational therapy approach. So that's currently being piloted and it's going really well.
Yeah, I was referred by the GP after having CBT and counselling because I was really struggling with suicidal thoughts and a few other mental health problems after losing my sister. They allocated me a care co, and she's been with me ever since. She's not only helped me, but she's helped my family members as well. I've been on the safety and stabilisation course, which deals with things like past traumas and how to deal with them. I'm now on the coping skills, which teaches you how to cope better in situations, things like distress tolerance. So that's all helping me, and I'm a completely different person than I was just nearly 12 months ago.
The team has worked incredibly hard. There have been a lot of challenges over the last few years, not least COVID, but we've also been playing our part in broader transformation as Staffordshire moves to ICB.
And another major success that we've got now is we're linking with the Vulnerability Hub. Networking within the CMH team is paramount to the support we can offer service users by being able to link in these various organisations. And the Vulnerability Hub is chaired by Staffordshire Police, and we have this weekly, and we have a number of vulnerable service users, and it gives them that additional support. It helps them to pull them from potential crisis situations and put them back on the road to recovery. And since we've gone into the COVID and work in different ways, it's now delivered over Microsoft Teams, so there's a greater attendance, which is just enhancing the reputation of the Vulnerability Hub.
Hi, my name's Dr. Ashcombe. I'm one of the junior doctors who works over here at the Ashcombe. I'm one of the core trainee psychiatrists. Okay, so as one of the junior doctors here, I sit in on the clinics. I see a lot of patients in my own clinics with supervision from the senior doctors over here. And I help with sort of general day-to-day tasks such as checking blood tests, checking ECGs, and helping with the day-to-day running of the centre.
I'm Jade Bentley. I'm one of the community psychiatric nurses. So I've worked alongside the clinical psychologist to set up the trauma stabilisation pathway at the Ashcombe Centre to look at trauma recall, flashbacks, nightmares, dissociation, and help people learn skills to manage those symptoms on a day-to-day basis.
So I'm Marianne. I'm the senior therapist within the Moorlands Community Mental Health team. Within the past 12 months, we've formed a county psychology team, so that's myself, the psychologist here, and the psychological therapist and psychologist at the Linebrook Centre. So we formed one team. And then what we've also been able to do is help to devise and deliver psychological interventions. The really most exciting thing is that we've been able to support our colleagues, nurses, occupational therapists, doctors, social work practitioners to implement assessments using a formulation-based approach and provide low-intensity psychological interventions. So that's really exciting because it means that our service users have got greater access to a range of interventions.
Been with yourselves just under, what, been 11 months into coming up for probably, give or take a bit. Yeah, it's been different, I suppose. It's had a lot of help from Becky Barlow and James and Maxime. Maxime's helped me whilst doing the A&D pathway. Helped me quite a lot. Been quite responsive as well. If we needed anything on the phone straight away. Been in a couple of crises last year, again, quick to respond to. So yes, considering secondary care, yeah, it has been a good experience.
So I'm one of the student links that works with Keel, and we have about 3 to 4 students at a time. So they observe, we help them build their skills, their confidence within nursing, and then they move on from us.
So within my role as one of the junior doctors here, I'm in part of a training pathway. So we rotate every 6 months between areas. So I've worked on inpatient units before and I've worked at other outpatient units before. So I'm just finishing up at the Ashcombe Centre, and I think it's been really helpful for me to be here. It's helped me to develop as a doctor, develop as a person, and I've really been glad to be part of the team. It's a really well-rounded and supportive team, and I can see that every individual's got the patient's best interests at heart. And I think that's really something I've been able to learn from and gain experience from. And I think it's put me in a better stead for my future placements going forward. So I'm really glad to have come here.
So my name's Shannon Bentley and I work for the Future Focus team, and my role is basically working with people on their needs. So it's supporting them. It's quite a diverse thing really, because whatever it is that that person presents with, then that's what we'll support them to do.
So over the next 12 months, I'm hoping to set up the young persons group. We're hoping to get that up and running, which is really exciting. We're also continuing to work on supporting those with ASD, autism spectrum disorder. We're hoping to be able to adapt our service to be able to suit their needs a little bit better and ensure that they're having the same outcomes as our other service users and aren't being discriminated against.
I see the team go above and beyond their duties every day. The changes we've been able to implement have had a real impact on the outcomes for the service users and the staff.
We want to lead on transformation at the Ashcombe Centre. I think we have a track record of innovation. Being small allows us to do things quickly, and I think the team are not ones to sit on their hands for very long. I think one of the things that's impressed me about working with my colleagues, we've got some older members of staff, we've got some people who've joined us more recently, and all of them have shown an appetite for doing things differently. All of them are very, very patient-centred. I think when you're busy, when you're trying to deliver great patient care on limited resources, sometimes a casualty is your compassion and your kindness. And I think that our staff absolutely embody the trust values, a more caring, more kindly and more patient-centred team. I think it would be hard to imagine. I'm extremely lucky to work with them.